probably our biggest bill is to get full practice authority for APNs. We have been working for over probably 25, 30 years to even get advanced practice nurses to be able to practice in New Jersey. We were able to accomplish that in the late 80s, early 90s. Through the years, we were able to get them prescriptive authority, and that's where that collaborating agreement came in. In other states, APNs do not need a collaborative agreement. They can prescribe without that. But for New Jersey to be able to get that little piece of scope of practice, we had to say, okay, we'll let the physicians have a collaborating agreement. We have proved over the last 10 to 20 years that advanced practice nurses can practice without a physician hovering over them. It is not supervisory in New Jersey. It's just that if I have an issue with a patient and I want, to talk to someone about it, I have a collaborating physician to do that. So hopefully, with both candidates that are out there, we're going to be able to work with them to have that collaborating agreement removed next year. Now we're in a new we're going to have a new legislative session starting in January because we're now voting for the entire legislature, Assembly, Senate, and the governor. So we're going to start all over again in January from the bottom. So we're going to have to go out there and do all our lobbying again, get our sponsors back on our bills, get our bills posted. But we're lucky enough that our sponsors of the bills are extremely strong in both on the Senate side and on the Assembly side. We have Munoz on the Assembly, and we have Vital on the Senate side, so we know those bills are going to get posted, but then we got to do that groundwork of trying to get sponsors. So we're probably going to spend, after election, the next 6 to 8 months really lobbying hard to get that bill gone through both the committees in the Health, on the Senate and Assembly side, and then to the full Assembly and full Senate to vote. Now our challenge is our governor. Who will our governor be? All right. We are in the process of looking at having what's called a town hall in October. We're hoping, and we're keeping our fingers crossed, that we will have the gubernatorial candidates attend our town hall. We're kind of titling it Healthcare and Nursing post-Christie era. And see, what we'll have, of course, a moderator. We have been able to get Steve Adubato to moderate for us. He will be working with us over the next few months to develop appropriate questions and keeping this very, very professional and very focused on healthcare. So keep your Facebook, your tweets active there to see, what's going on as far as our moving forward with that. If for some reason we cannot get the gubernatorial candidates, and that's a possibility because we're not a major organization, we're not a news media outlet, so their handlers may or may not allow the candidates to join us. We will have a town hall anyway, and then what we'll have is we'll have our legislators, both from the Assembly and the Senate side, to join us and discuss healthcare issues that impact nursing. So we have a plan A and a plan B, so keep posted on where we're going. And I have to say, Gail has been very instrumental in helping us. So she's one of our committee members, and we really appreciate all the help that our past presidents have done for us. So there's a lot of people in this room that really have been very active at NJSNA, helping us with our political action and lobbying. So we do appreciate everybody's help.
How many of you are APNs? Okay, so what's the challenge around collaborative practice? What are the challenges?
I have to say, well, usually it's the hospital, it's the organization that you work with then, determining your credentialing and your scope of practice and your privileging. So, and how you can sign, who's signing after you, and it's a whole big. The other big challenge is that they don't really in New Jersey they don't recognize clinical nurse specialists as advanced practice nurses. They are just educators. I mean, and that's what they say. Well, you're the educator. No, we're the advanced practice nurse. And to try to explain that it's just it's.
There are 3 key issues that I've come to know. How many of you were born after 1979? Will admit.
Oh, put your
put your hand. Well, I became a nurse practitioner in '79, so I've been hanging out for a while and have a sense of this stuff. However, when I went to certify, my program did not meet nurse practitioner elements. I had the 3 Ps, but because of the content stuff, I had to board certify as a CNS. So this is one of the few states where I have prescriptive privileges.
Right.
One of the issues around collaborative practice is this whole thing of tethering and control. I worked in a large hospital in northern New Jersey, and I applied for privileges, and they lost my application. So I resubmitted my application, and they lost my application. So I resubmitted it a 3rd time, because I'm stubborn. And they let the medical credentialing physician go, and they found my application, and I was credentialed, but I was never allowed to work because the physicians were unionized, and they would not allow an APN to come in and do anything. Physician control. In the state of New Jersey, I call it medical extortion. We have a bill that says APNs must have a collaborating agreement. There is no penalty to physicians. In fact, it opens a door for them to charge for APN services and now to charge to sign on the collaborating agreements. People are paying anywhere from $0 to several $1,000s a year for a physician to sign a collaborative agreement. So we have medical extortion and we have a disconnect. We have to have the collaborating agreement. There's no government supervision over the physicians. However, the state can come in under their regulations and request to see a valid, updated collaborative agreement, or they will fine the agents. Then you have physicians now in certain areas, site being one, where they're circling the wagons because we are a threat to them. And so they are refusing to sign up. My collaborating agreement expired last November. So in last October, I sent a note to my collaborator, which would be willing to re-up. Well, knowing his return time, I thought after a month, well, he'll get back to me. See if anyone were dying or critically ill, what this means. So I sent him his annual check, never came back. So at Passover, I sent him a happy Passover. And he texts me, oh, thank you. We should probably talk about this issue here. He said, but I'll call you, it's Passover, I can't talk tonight. No problema. Monday of this week, I get a notice from one of the agencies. The state wants to see your signed collaborative agreement by Friday. I'm like, well, there's another $5,000 call. I said, you remember I told you I had a sort of iffy collaborative agreement. Oh, and you can fill in the blank was what came back on text. So I happened to go to a dinner last night, sitting around with some physicians, and I was talking to the nurse practitioner across from me about the struggles with collaborative practice. She leaned over and she said, give me a call, I can work with you. And it's like, thank you, there is God in heaven. Because I reached out to 5 other physicians, 3 didn't bother to return the call, 2 of which I had worked with in several agencies. 1 I had worked with in 3 different systems, and he said, it's a supervisory activity, I will not do it. I said, it's not supervisory, it's collaborative. No, it's supervisory. And I said, well, thanks, I'll keep your email in case I need it with my attorney. I did, I said that. And the other one said, well, what's in it for me? And that was one I was working with. He had the office right across. So,
Pediatrics is very different for, I mean, I've never had a struggle with that in terms of that. We also run the charity clinic down here in Trenton, so, you know, it's not very difficult to get a collaborating physician.
Think about the fact that nurses are the people who see patients in every setting. And many of the people we see don't have good health insurance. They may be on public health insurance. These are not the people the physicians want to see. In fact, most of them won't take them in their office anymore.
That's right.
So we're out there doing it, but they don't want us to do it because we're a threat to them. So that's a big challenge, and that's why we have to stay on top of the legislation. If you follow the governor's swan song, there's help for you in New Jersey for your opioid addiction. Okay, so, were you with me yesterday? They called they referred one of their patients to the hotline. The hotline picked up and said, okay, what kind of insurance do you have? And they said, well, we have Medicaid. Well, there's nowhere we can really send you. Exactly. He has defunded all the opioid programs, but he's making commercials. There's help out there for you, but it's only for you if you have top tier health insurance. That's the unspoken portion.
And people don't say it's cost because.
And if a bed's available, because there are minimal beds.
Right.
Exactly. Right, because people have closed down, they don't have the funding. And think about the opioid epidemic. Judy and I came down to the Statehouse in January to give testimony on the opioid bill. Not 10, not 5. 1 minute before it was to be heard, they pulled the bill.
Yeah, they do it all the time.
Pulled the bill, so it wasn't going to be heard that day. But they assured us and our lobbyists that APNs would be recognized. They smushed 5 bills together, the governor signed off, and APNs are not in it. And APNs cannot make mental health and addiction referrals.
Well, they can make the referrals, they won't be paid.
Exactly. So that's what happens when you don't stay on top of what's going on in the legislation. They will look at you in your face and say, yes, we've got you covered, and it comes out and you can't find your name anywhere. And all of a sudden, portions of your practice have been moved away.
And a little follow-up to that, Bill, is that we lifted the roof off the Statehouse, literally. So we did have a meeting, and what happens a lot of times is the Office of Legislative Services is the group that really crafts the language of the bill. And for some reason, they thought that because psychiatrists were in the bill and advanced practice nurses had a collaborating agreement, that would make the bill okay. It doesn't. But anyway, so we brought the Office of Legislative Services, the actual crafters of the bill, the Senate Majority Chief of Staff, and also a couple other chief legislative aides, prominent senators, legislative aides. And we are working on another bill to help with the APNs able to be reimbursed, is the issue, for their mental health referrals. We've also have a second track in that we went to the Board of Nursing, because in the Board of Nursing under rules and regulations, they can correct some of the bills that are out there. So there is a Deputy Attorney General that's working on the language on rules and regs. So we got 2 avenues that we can go to. The good thing about it is it does allow the advanced practice nurses to prescribe opioids. Because remember, it was all those opioids, 5 days, 10 days, 30-day supply. Well, there were so many bills out there, they switched them together, as Ben had said. They did keep the APN in prescribing opioids, but they dropped them in the beginning of the bill because nobody was watching how it got switched together. The governor was putting so much pressure on the legislators that I don't believe anybody read the bills. I think they just said, let's get them out there, and it was all about getting that opioid prescriptive down to 5 days, or 7 days. That's what it was all about.
I do have a question though, and I know that you and Ben had said the same thing about language, that the language is not right in the bill, so we had to, explain, like, what do you mean by language?
Ben was referring to a multi-state compact. What has happened historically, and I would say Barbara, probably back to maybe when you were executive director,
I have 5 minutes.
Come on, come on, come on, come on.
Hello,